representatives from development partners, heads of UN bodies, our esteemed partners, distinguished ladies and gentlemen, participants of this National Stakeholders Dialogue on Mental Health Rights in the Gambia. I also acknowledge the security and the media they are present. I have the singular honor and pleasure to host this National Stakeholders Dialogue on Mental Health Rights in the Gambia. You will recall that the National Human Rights Act 2017 has given broad mandate to the Commission to promote and protect human rights in the Gambia. In order to build resilient and equitable societies, would require addressing mental health issues. And this is in line with Sustainable Development Goals. Mental health is key in the lives of human beings. Various studies have been conducted that highlighted the significance of mental illness across the world. The National Human Rights Commission has acknowledged mental health both as a health issue and a human rights issue. Hence, we are gathered here today with our partners, UNICEF, WHO, Action Aid the Gambia, AfriCell, in order to commemorate International Mental Health Day. We were supposed to have done this program on the day itself, but due to factors beyond our control, we had to reschedule. Essentially, this is the purpose of our gathering. As tradition requires, if you call people in the Gambia, you would still tell them why you call them. We are gathered here today to initiate a national dialogue on mental health issues and rights in the Gambia, and put mental health on the development agenda. This is the broad objective of this program. We intend to raise awareness of the importance of mental health issues and human rights, the linkages between human rights and mental health. The dialogue seeks to also identify various difficulties and challenges individual faces relating to mental health issues, and also to promote a more tolerant and supportive mindset regarding mental health problems in the society, and also provide a forum for the exchange of information on how best to enhance mental health services in the Gambia. By the end of this program, we aim to create more understanding and awareness of mental health concerns within the Gambian society, and also create more collaboration among partners in the field. Already, the National Human Rights Commission has been organizing awareness programs. I'm sure you would have seen the billboards around, sponsored courtesy of AfriCell. Flyers were also created, and some radio talks were also done, spearheaded by our honorable chairperson of the National Human Rights Commission. Without wasting much time, I would now like to call upon honorable chairperson, National Human Rights Commission, Mr. Emmanuel Daniel Diouf, to come forward and deliver welcoming remarks. Honorable Chair, you are most welcome.
The moderator for today's opening ceremony, Your Excellency, Mohamed B.S. Jallow, the Vice President of the Republic of the Gambia, the Deputy Permanent Secretary, representing the Ministry of Health, Reverend Savali, you're most welcome. Representative, the UN Resident Coordinator, Mr. Carl Frederick Paul, thank you for being with us today, and representative of the various UN agencies present. I've seen them lined up in front. Nairobi, Nafisa, uh, Jane Minor, all of you present, and also the development partners present here. Madam Ndela Faikoli, the Executive Director of Action Aid International, the Gambia. Thank you very much for being here with us. Madam Mam Jara Meraga, you're welcome. Program Manager, National Mental Health Program. Distinguished representatives of government and development partners present, the Vice Chairperson of the National Human Rights Commission, Madam Jainaba John, Commissioner Nunudrame, Commissioner Imam Babali, Commissioner Halimatu Diba, the Executive Director and staff of the National Human Rights Commission, and ladies and gentlemen, distinguished guests, members of the media, it is my honor and privilege to welcome you all to this two-day national stakeholders dialogue on mental health in the Gambia, organized by the National Human Rights Commission. Sincere appreciation really goes to His Excellency, the Vice President of the Republic, for gracing the occasion despite his very, very busy work schedule. And of course, I extend my deepest gratitude to our partners, Action Aid, the Gambia, UNICEF, the World Health Organization, AFRICEL, for their invaluable support in making this dialogue possible. Thank you so much. Ladies and gentlemen, mental health is a subject that touches every one of us, either directly or indirectly, and yet it remains one of the most misunderstood and stigmatized aspects of public health. Like many parts of the world, the Gambia included, stigma and misconception around mental health have prevented open discussion. It has hindered timely interventions, and it has exacerbated the challenges faced by individuals living with mental health conditions. The WHO, World Health Organization, tells us that 1 in 4 people globally has experienced or will experience, are experiencing or will experience mental health or neurological disorder at some point in their lives. This is quite a high number, 1 in 4. So just count 1, 2, 3, 4. One of us must be. I don't know who. 1, 2, 3, 4. But it is indeed interesting. But here in the Gambia, it is estimated that 27,000 people suffer from mental health and or substance abuse disorder. Again, this is very high, severe. And an additional 91,000 individuals are living with mild mental health challenges that require treatment. These figures are alarming, ladies and gentlemen, and they demand urgent and coordinated action. When you compound these challenges, the troubling rise of drug-induced mental illness. This is a phenomenon that is placing additional strain on families, on communities, and on our already limited mental health infrastructure. The Tanka Psychiatric Unit, which is the primary facility dedicated to mental health in our country, continues to grapple with inadequate human, material, technical, and financial resources, leaving countless individuals without the care and the support that they desperately need. The National Human Rights Commission, since its operation in 2019, recognized that mental health is not only a public health issue, but it is also a critical human rights concern. Stigma, discrimination, and neglect surrounding mental health often results in other violations of fundamental human rights, such as the right to health, the right to dignity, non-discrimination, and an adequate standard of living. It is therefore imperative that we foster a more inclusive, informed, and rights-based approach to addressing mental health in the Gambia. In 2023, the National Human Rights Commission carried out a study which was validated and published, titled Advisory Note on Mental Health Rights in the Gambia. This advisory note recommended that the Minister of Health, the Minister of Justice, and the Minister of Gender, Children and Social Welfare should collaborate to conduct a comprehensive review of laws and policies relevant to mental health, with a view to bringing them in accordance with the Gambia's international obligations. These laws and policies should incorporate the principle of non-discrimination and create equal access to mental health treatment. It was also recommended that the Ministries of Health and Justice should put in place mechanisms of health, mechanisms also to ensure that no person with a mental health illness is arbitrarily deprived of their liberty based on their impairment or for an alleged danger to themselves or others. Currently, the law we have in the Gambia addressing issues of mental health is the Lunatic Detention Act, which is a colonial legislation which was enacted in 1917 and amended in 1964. You can imagine it is very outdated. It has outdated provisions. Even the name of the act tells you Lunatic Detention Act is not even sensitive to issues relating to mental health. So there is a need to review our laws and policies so that we can have a framework that deals with mental health issues. And this should happen, ladies and gentlemen, because the Gambia has ratified international and regional conventions and treaties addressing issues of mental health. The International Covenant on Civil and Political Rights, for example, Article 12 requires that state parties, and which the Gambia is a party to, should recognize that everyone has the right to enjoyment to the highest attainable standard of physical and mental health. Similarly, our own regional convention, the African Charter, also known as the Banjul Charter on Human and People's Rights, Article 16 provides that every individual shall have the right to the best attainable state of physical and mental health. We also have the Convention of the Rights of People Living with Disabilities, which the Gambia has not only ratified, but it has also domesticated in the name of the Persons with Disabilities Act 2021. Again, if you look at the provisions of the convention and the act, it compels the state, which has the primary duty to address and find solutions to issues surrounding mental health. The national dialogue, as was stated by our executive director, is therefore a strategic platform designed to raise awareness. It's important that we talk about these things so that we know. Many of us do not know about mental health, its importance, its intersection with human rights, the challenges what are the challenges? And there are many, and I'm sure in the next 2 days, you will realize, the mental health experts, they know this. There are many challenges that face individuals in accessing mental health services. Promote societal tolerance. We have to. Facilitate exchange of ideas. and also to advocate for the development of laws and policies that integrate mental health into national development agendas. We, as the National Human Rights Commission, firmly believe that addressing mental health challenges requires a collaborative effort, and this can effectively be done by bringing together, as we have done, stakeholders from diverse sectors to explore innovative solutions and chart a way forward. For far too long, mental health has been at the margins of our national discourse. The lack of public dialogue, inadequate policies, and insufficient support systems for those affected have hampered progress in advancing mental health literacy, providing services, and developing appropriate laws and policies in the Gambia. The NHRC is committed to ensuring that the human rights of all individuals, including those living with mental health challenges, are respected and protected. This dialogue is consistent with our mandate to foster a culture of human rights in the Gambia, leaving no one behind. We envision a society where individuals affected by mental health illness can access quality, affordable, and appropriate care without fear of stigma or discrimination. As we deliberate over the next 2 days, let us remember that mental health is integral to our overall well-being. By addressing mental health challenges with the urgency and compassion that they deserve, we are not only improving individual lives, but also strengthening our communities and contributing to sustainable development of our nation. Your Excellency, ladies and gentlemen, I encourage each one of us here present, and especially those who are going to be here for the next 2 days, to engage actively, share your expertise and experiences, and contribute meaningfully to the discussion. Let us leave this forum really with actionable recommendations. This is important. That will lay the groundwork for informed policies, community-based intervention, and collaborative efforts to promote and safeguard mental health in the Gambia. But I cannot conclude by giving special thanks to NHRC staff and the commissioners who work hard diligently to put the dialogue together, but especially to our Vice Chairperson, Madam Jaina Bajom, who has been at the forefront of this campaign to give mental health the publicity it deserves. We have actually named her the Commissioner for Mental Health as well. Special thank you. Once again, on behalf of the National Human Rights Commission, I thank you for being present here and for your commitment to this vital cause. I wish you all a very fruitful deliberations and look forward to the impactful outcomes of this dialogue. I thank you all and welcome again.
Mr. Frederick Paul, honorable staff from representative of the honorable minister, my own brother, Dr. Babaning Sabali, representatives from the ministries at the national and local level, but of course, our development partners, especially the UN system. Like they said earlier, we've seen them lined up at the front, but of course, I'm sure we have others in the midst of the people. But representatives also from the civil society organizations, community-based organizations, advocates and activists, because we all work together in this. Partners from the media, distinguished ladies and gentlemen, good morning to you all. I am indeed delighted to be here with you on behalf of ActionAid Gambia to make some few remarks on such an important and timely national dialogue on mental health. I think my predecessor did a good job to reduce some of the things I want to touch on. But of course, mental health has been and is still an issue of concern in many countries, and the Gambia is no exception. This is increasingly true with more vulnerable groups being affected by mental health problems, particularly the youth, who make up a large proportion of the Gambia population. I'm sure within the 2 days we'll be able to get really the figures as they break down, because looking at the agenda, we have the specialists, the service providers to come and share with us detailed information. Guided by our core values of mutual respect and equity and justice for all people, especially those living in poverty, with our fervent belief in the human rights-based approach to development, and given the current state of mental health in the Gambia, Action Aid deemed it necessary to collaborate with the National Human Rights Commission to facilitate such a dialogue with stakeholders to promote a national discourse on mental health. Like the commissioner said earlier, we know, of course, we have so many challenges, so many problems, but mental health is also an important area that we need to give focus on. This is principally guided by the fact that our drive for inclusion and equitable access to services and the fulfillment of the essential rights of disadvantaged individuals, as indicated in all our national strategies and frameworks, cannot be achieved unless deliberate actions are taken to deal with some core issues that currently affect us, and one of which is mental health. Ladies and gentlemen, the current state of mental health in the Gambia is confronted with outdated policy and legal frameworks, which limits the efforts of stakeholders as we work to serve the affected population now and in the future, unless action is taken. There exists the Lunatic Discharge Act of 1917, which was mentioned earlier, which is now over 100 years old and yet to be replaced with an updated one that addresses the current realities of our time. The draft mental health bill, which was validated in 2019, is yet to reach Cabinet and the National Assembly for approval and rollout for use by stakeholders. The existing draft mental health policy developed in 2007 is also outdated, even if it was used by now, it really needs to pick up the emerging issues that we are aware of, and therefore to confirm needs of updating to conform to the new emerging issues in line with national frameworks, because we've gotten our new national development strategy, just like many other organizations have also gotten their strategic frameworks upgraded, but more so to align it to the international norms as prescribed by the United Nations Convention on the Rights of Persons with Disabilities, which the Gambia signed since 2015. We now have a disability policy, we also have a disability act. All of these things are recent, but having the mental health frameworks been outdated, of course, will usually include some mismatch in the use of these documents to guide our work as we serve the population. Of course, it is noted that the Gambia did well in ratifying a number of instruments that include provisions for the recognition of mental health rights, including the CRPD, as I mentioned earlier, and the African Charter on Human and People's Rights. However, much cannot be done on mental health without amending the country's policy and legal provisions to conform with the international obligations that respects the rights of people suffering from mental health. We're in the era of human rights for all, and human rights for all cuts across everyone, irrespective of their mental, social, and psychological status. We are aware, of course, that the government, through the Ministry of Health, developed initiatives aimed at creating access to mental health at the level of primary healthcare facilities. And we do recognize and applaud the support of development partners for the support given to government in improving the capacities of health workers as well as mental health sensitization activities. However, these programs, as well as mental health, these programs are limited by many factors, including the limited number of mental health specialists, as well as proper resources, which of course goes down to limit the quality and the accessibility of the services as needed by people in both urban and rural areas. We do take note of the fact that the Tanka Tanka Psychiatric Hospital, CSOs, community and advocacy groups have been offering services in both conventional and traditional form. However, they are still quite limited in terms of quality and outreach. And we want to use this forum to make the outcry for us to do more and expand more. The treatment of people affected with mental health is highly been criticized for being so urbanized, because most of the facilities that are available are only available in the rural area, with very much spontaneous service in the rural area. And of course, like I mentioned earlier, this is worsened by the limited number of psychiatrists, psychologists, and other specialists needed to deliver quality mental health services. And of course, even to do some preventive services before we even reach to a point where somebody needs a serious and more specialized service. Mental health remains one of the most challenging conditions in the society that we live in. We do know we have many challenges, but mental health is really one of them. The socio-cultural beliefs associated with mental health has, among others, contributed to negative biases towards the mentally ill and their social exclusion. Such issues nurture a sense of stigma and discrimination, which prevents most individuals and their families from coming out for help. Many get isolated, and this affects their human rights and dignity. And these are things that we see all over in our neighborhoods, in our families, that there are some people with these conditions, but for stigma and discrimination, we tend to keep them, which is not fair. Young people in the Gambia fall under the category of those most vulnerable for mental health issues due to, of course, many factors, including unemployment, social and economic pressures at individual, family, and societal level. Now we know that this is now aggravated by the effects of irregular migration, trauma associated with returnees coming back with experiences from from their back way, and the disappointment of not reaching out and coming back to, in many cases, families that are not welcoming you because they really see you as a failure. All these things put together requires us to really pay attention. But on top of that, also, we know that there is widespread abuse of drugs. And of course, if we do not take action now, it might be too late. Because with young people being at the center of those most affected, we need to do something now and not later. Some will say we should have started many days ago, but you can always start from somewhere. Stakeholders with the leadership of the government, as the primary duty bearer, as mentioned earlier, have to step up to improve the policy and legal environment, service provision, as well as to invest on preventive measures to reduce this national phenomenon. We know that some preventive measures can be done to reduce the escalation to where it is or to get worse. Really, if the recovery focused national development plan, the SDGs, and all other national and international frameworks are to be achieved without leaving no one behind, then mental health in all its facets have to be improved, implemented, and monitored to improve access in all parts of the country, not just the urban area, but even in the most hard to reach area. Despite, of course, the gloomy situation, hope is not lost. ActionAid would like to use this opportunity to advocate for mental health reforms we prioritize now and not later. And I want to make this ask through Your Excellency, the Vice President, as the number two of the country, number two in the country leadership. I want this message to really pass through you. We want the government, we really want the government to push for the mental health policy and bill to be aligned to the human rights the frameworks, finalized and sent to Cabinet and Parliament for approval as soon as possible to improve the policy and legal framework for mental health. We also want to request the government to prioritize mental health service delivery and increase budgetary allocation to cater for the training and material needs of mental health services for improved quality delivery. We always have been reminded that we don't have enough, but in the midst of inadequacy, prioritization can do a lot, and that's what we are requesting. We encourage collaboration and support for capacity building of service delivery institutions and caregivers to understand the new policy, because I'm anticipating that as soon as possible we get these documents in, it requires a lot of support to be able to roll it out for different stakeholders to understand and make use of them. This will ensure appropriate use of the document to enhance service delivery. I also want to use this opportunity to encourage stakeholders, especially our development partners, and I'm happy that the UN system is in front, and those that I may not have the capacity to recognize. But of course, civil society organizations and activists to continue collaboration. And the collaboration comes in different forms. We can deliver programs together, but we can also give investment so that there is improvement in the service delivery. But we also want to encourage that we all work together as stakeholders to join the campaign to raise awareness and reduce stigma and discrimination, using both conventional and social media channels to promote the rights and dignity of people with mental health. Because we all understand that the human rights is for all, irrespective of the mental or psychological economic situation of the people. And those, of course, with mental health are one of those groups that we know have been marginalized for too long. In conclusion, I wish to note that ActionAid remains committed to collaborate with stakeholders to pool our limited resources. Of course, we all are working around limited resources, but when we prioritize, we can always give investment to where it is more needed. But together, we can improve mental health advocacy and service delivery in the Gambia. Of course, as I requested earlier to the Vice President, I wish to applaud the government for all the efforts made in the various sectors, despite all the challenges noted earlier. Our cry is to push for, our cry is really to push to the attention of the existing gaps before it gets worse. And this could not only affect the people, but it could also affect our peace and stability as a nation. I wish to appreciate the financial support of development partners, here present and those who may not be around, as well as all the different partners at the forefront delivering services for mental health, directly or indirectly. And want to say that this is just a manifestation of our shared goals as we together serve the citizens and residents of the Gambia. A big thank you, of course, goes to the National Human Rights Commission for the collaboration and for the steadfastness in making this dialogue a reality. With the rich agenda displayed on the table and experts identified to partake in this 2 days dialogue, it is our hope that the outcome will bring, of course, positive and lasting changes for the policy and legal framework and improve service delivery for mental health in the Gambia, so that come next year, inshallah, we can be here to do a reflection of how much we've progressed and what more gaps to go. There is always, we can always start, no matter how small it is. And it is those small steps that can lead to big achievements. So I thank you all for the kind attention.
Represented by the Deputy Permanent Secretary, Dr. Sabali, all government officials present, Madam Executive Director of Action Aid, Mrs. Kohli, National Human Rights Commission Chairperson, Mr. Emmanuel Diouf, commissioners and staff of the National Human Rights Commission, UN heads of agencies, UN staff, and development partners here present, civil society, and members of the media, dear participant. Good morning to you and welcome. I wish to commend, first of all, the National Human Rights Commission for holding this important dialogue on the often neglected issue of mental health and human rights. Mental health as the right to health is a fundamental human right linked to obligations under human rights instruments such as the Universal Declaration of Human Rights and also the International Covenant on Economic, Social, and Cultural Rights. At the global level, progress on improving mental health in many countries remain inadequate and may violate human rights standards, and the Gambia is no exception. We also face challenges regarding improving mental health services and ensuring the full realization of the rights to adequate health care. Mental health issues, they do not know any boundaries and can affect any one of us. People with mental health issues are often deprived of basic human rights, including health, education, access to health, even and employment. Sometimes, and even in some countries, they are often neglected, mistreated, and frequently abandoned or abused. Worse, they are isolated and chained, for instance, to their own room or to their own beds. This is not acceptable in a world that seeks to treat all people equally. Our responsibility is clear. We must advance laws and policies that protect the human rights of those with mental health, but also with psychosocial disabilities, so no one is left behind. We must also reduce and end the stigma, including by holding open discussions such as this that we are holding today. Mental health must be treated as any other illness and should not be stigmatized. We must prioritize access to care and support in addressing inequalities in accessing mental health services, especially for vulnerable and marginalized groups. As we can understand and agree, mental health services must be accessible, available, affordable, and equitable, and this demands investment from governments and communities. Excellencies, ladies and gentlemen, I recognize and applaud the government of the Gambia commitment toward providing a system where mental health services are accessible, affordable, and of good quality for all. As the country starts the finance and budget debate at the National Assembly today, and tomorrow, sorry, we urge the state to ensure adequate budget allocation and mental health services for mental health care as a crucial building block for sustainable development and social cohesion. I am certain that under the leadership of His Excellency the President of the Gambia and also the Vice President of the Gambia, we will definitely meet this milestone. I thank and congratulate the National Human Rights Commission on holding this pertinent and timely dialogue. The United Nations here present will continue to advocate for holistic mental health care systems, prioritizing dignity, inclusion, equality, and human rights. We reaffirm our commitment in supporting the government of the Gambia, the communities, and the civil society toward the realization of the right of adequate health care, including mental health. There is no health without mental health, as this is marked here on the board here. We all play a vital role. Your presence here today makes it easier to imagine a future where mental health is celebrated and not stigmatized. I thank you all for your attention and I wish you a fruitful dialogue. Thank you very much.
My very good sister, Executive Director, Action Aid Gambia, Madam Fai, colleague, UN Resident Coordinator, Representative, Mr. Paul, Head of Agencies of UN System in the Gambia, the Commissioners of the National Human Rights Commission in the Gambia, senior government officials here present, service chiefs, security chiefs, CEOs, the media, ladies and gentlemen. Good morning once again. It's my pleasure to stand before you today to represent my Honorable Minister and the senior management team of Ministry of Health. I send you greetings from the Honorable Minister, who would have loved to be here himself, but because of other national duties, he couldn't make it. However, he's here in spirit, and he wants to extend his heartfelt thanks to National Human Rights Commission for organizing this very important convergence. He singled out the presence of His Excellency the Vice President to grace this occasion, which underscores the importance of this issue. Today, ladies and gentlemen, we gather to share light on the vital aspects of our society that warrants urgent attention and open discussion. WHO defined health as state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This therefore places mental health as an important element in all health dispensation. Untreated mental health represents life interrupted, potentials unrealized, and families affected. Therefore, the importance of engaging in national dialogue on mental health cannot be overstated. Our collective well-being, the productivity of our workforce, and the overall health of our communities hinges on our ability to address and understand mental health issues openly. For far too long, mental health has been reduced or remained in silence and misunderstanding. Many peoples grapple with mental health challenges in isolation, often feeling overwhelmed by feelings of shame or fear of judgment. Your Excellency, the National Health Policy 2021-2030, the theme calls for strengthening partnership for quality health delivery. Determinants of health, most of them are beyond the boundaries of health. Therefore, stakeholders coming to discuss issues of mental health is quite important. And the ministry recognized the important role played by National High Commission for Human Rights to call for this national dialogue. This national conversation is essential in breaking the cycle of silence and fostering an environment where individuals feel supported, recognized, and empowered to seek support. The social and economic consequences of neglecting mental health are profound. Mental health disorders affect hundreds of individuals and families across our nations. They not only impact those suffering, but also cripples effect on workplaces, our schools, and our healthcare system. The World Health Organization has repeatedly emphasized that there can be no health without mental health. Our challenge, and indeed our responsibility, is to create a culture where mental health is prioritized and addressed as an integral part of our overall health system. The Ministry of Health, with compelling or competing priorities, still places mental health as a priority within its health sector. The national policy, as the National Health Policy, gave a prominent role of national health, mental health, in its context. The ministry have strived to improve mental health in this country despite all the challenges. They've embarked on capacity building of health workers to deliver the services. They've established outreach stations so that the services come closer to those affected. They've done some resource mobilization to empower the units, that's the mental health unit. Despite all these efforts, there still remains a lot to be done. We therefore call for support from individuals and partners to come on board to support this. In our quest to ensure that universal health coverage covers the entire country, where no one is left behind, it calls for concerted effort from everybody to come together to address the issue of mental health. Government cannot do it alone, despite the fact that a lot of resource mobilization has been done within the ministry and above the ministry, but a lot more needs to be done. We talk about the psychiatric health hospital. The ministry is trying to transform that hospital to a modern one where issues of psychiatric care is given prominency in its healthcare delivery system. We are trying to make the psychiatric teaching hospital, psychiatric center, to be a semi-autonomous or autonomous institution where it will be managed by individuals with specialization in mental health care. The ministry is also embarking on and has started engaging partners to build a rehabilitation center where patients or individuals with disease-induced psychosis will not be mixed with the other individuals. These are all plans that are on foot to ensure that mental health services are improved in this country. As we move forward with our national conversation on mental health, Let us remember that this is not merely about policies or programs, it's about people. It's about the individual stories of struggle, resilience, and recovery. We must advocate for inclusive practices that ensure everyone, regardless of their background or circumstances, to have access to mental health care. Together with the unwavering support of our partners, we can cultivate a culture of understanding and empowerment that uplift every individual. Let us commit to the future where mental health is seen as not only a burden, but as crucial aspect of our collective well-being. A future where individuals feel seen, heard, and valued. In conclusion, the Ministry of Health wants to reaffirm its commitment to the cause of mental health. We are looking forward to the recommendations coming from these convergences to inform us to come up with a policy that will address the issue of mental health, and by extension, to formulate an act that will stand the test of time. On that note, once again, we want to thank the Vice President for gracing this occasion, and then the Chair and the Vice Chair of the Human Rights Commission for coming up with this laudable initiative. On that note, we thank you all, and may Allah bless us all. Thank you.
Agencies, we are present. The Executive Director of Action Aid International, and other members of civil society organizations here are present. Representative of the Honorable Minister of Health, DPS Savali, who is here with us, and other senior civil servants here present with us. This the Executive Secretary of the National Human Rights Commission and staff, the media, distinguished guests, ladies and gentlemen. It is a great honor for me to deliver this keynote address at such a significant gathering. Mental health remains a critical global issue. The World Health Organization, as we have been informed earlier on, estimates that 1 in 4 people will experience mental health illness in their lifetime, with depression and anxiety alone costing the global economy approximately $1 trillion annually. In the Gambia, the rise in mental health conditions exacerbated by the abuse of illicit substances like kush, cannabis, and other hard drugs has become a pressing concern. The 2020 Service Statistics report highlights the adverse impact of the COVID-19 pandemic, further intensifying mental health challenges in the country. And I think somebody has also talked about the issue of the returnees, which is becoming very serious for us. And I think we have already started discussing with development partners to see how we can have a transition center where when they come in, to give them, to provide them support before they can be going back to their families. This national dialogue on mental health is both timely and crucial, offering an opportunity to raise awareness, reduce stigma, and recommend effective strategies for improving mental health services and tackling drug abuse. Unfortunately, public awareness about mental health remains low in the Gambia, often leading to stigmatization, neglect, and reliance on unapproved practices. According to adopting a human rights-based approach to mental health requires a holistic framework guided by equality, non-discrimination, inclusiveness, and participation. While there are gaps in the domestic legal framework, the Gambia's international commitments, including adherence to the African Charter on Human and People's Rights, the Convention on the Rights of Persons with Disabilities, and others, demonstrate our dedication to improving mental health standards. Ongoing reforms, such as the constitution-making process and the drafting of the mental health bill provide opportunities to strengthen domestic legislation, protect the rights of people living with mental health conditions, and enable equitable access to services. Excellencies, ladies and gentlemen, given the clear link between drug abuse and mental health issues, the Green Recovery National Development Plan, prioritizing drug and substance abuse prevention and mental health rehabilitation under outcome 6.3. This strategy focus reflects the growing threat posed by drugs like cocaine, heroin, and various controlled substances as evidenced by recent seizures. Additionally, the government is committed to achieving the United Nations Sustainable Development Goals, particularly the targets on strengthening the prevention and treatment of substance abuse and ensuring universal health coverage. Similarly, the African Union Agenda 2063 aspires to create the Africa we want, emphasizing health, well-being, and youth empowerment. None of these ambitious goals can be achieved without prioritizing mental health. As the WHO notes, poor mental health undermines productivity and well-being, leading to significant economic losses. I therefore urge all stakeholders to collaborate in promoting, protecting, and fulfilling mental health-related obligations. By improving mental health services, reducing stigma, and enhancing public awareness, we can foster a compassionate and inclusive society while alleviating the economic and social burden of untreated mental health conditions. In conclusion, Excellencies, ladies and gentlemen, the government of the Gambia remains fully committed to advancing mental health in partnership with development partners to achieve the goals of the Recovery Focused National Development Plan at Agenda 2063 while upholding our national obligations. I also want to take this opportunity, as been mentioned by two speakers earlier on, to confirm, as the DPS has mentioned, that during the budget discussions of this year at Cabinet, Cabinet has taken the decision to upgrade the Tanka to make sure that it's a separate institution from the Edward Francis Small Teaching Hospital, so that it can attract funding and specialization also. I want to take this opportunity to congratulate the conveners of this dialogue. I wish you fruitful deliberations as we collectively work towards a healthier, more inclusive Gambia. Thank you for your kind attention. As the chairperson has said, he has stressed the 1 in 4, and sometimes it can happen. Because I just want to share a personal experience actually. Because one of my children at some point suffered temporal memory loss. It was like stressful for the whole family. But again, using my experience as a teacher, I realized that it was due to societal pressures. And most of the time, everybody comparing them with their father. Your father this, your father that, your father this, your father that. So really, it was like stressful, like I said, but I could see how it impacted all the other children. But thank God, we are able to pass that. So you can imagine, like you said, how it can happen, it can help, it can affect people in many other areas who are not as endowed as maybe we were. So really, we want to thank you for this opportunity and take the opportunity also to declare this open. Thank you, sir.